left only.
Test.
It's just one side, so. Two, hey, hey.
want to, at this time, invite our financial controller, Mrs. Shari Hooper-Scott, to open us in a word of prayer.
Loving God, we give you thanks for this day. Father, we come at this time to seek your blessings upon this symposium. I ask, dear Lord, that you will bless all. Give us focused minds, O God, and help us that whatever we would have learned today, we will. And we ask, dear Lord, that you will touch every hand that would have worked together to get this.
Invite our marketing manager, Mrs. Melissa York.
Welcome you on behalf of the management and staff of the St. Vincent and the Grenadines. So many lives. Cervical cancer. Today, empowerment isn't just about finances. It's about caring for the whole person. Gifts we can give ourselves and our families. Thank you to everyone who made this event possible, and sort of insight as to how the afternoon will flow for question and answers. And if you are viewing us on YouTube or Facebook and you have a question, please enter it.
She is now head of department of the obstetrics and gynecology. 2006, Dr. Nicholls was inducted as a fellow of the American College of Women's Organizations, church groups, and school children, empowering them with knowledge and information. So put your hands.
I am humbled. Let me see. Heads this program will enlighten us in a few minutes. Cancer is the growth of abnormal cells in the lining of the cervix, or what we call the neck or mouth of the womb. We know that it is caused by sexual contact, whether it's oral, and therefore we should have 0 deaths. Why? There is an intern at the University of Miami and now introducing HPV DNA testing, which is far more sensitive than the pap smear. 2021, 2022 we saw 12, 2023 we had 9, and last year we had 7. Death from cervical cancer is very, very debilitating, and it's hard to providers is to reach every woman in St. Vincent and the Grenadines, educating them about pap smear, charge of our lives. Thank you.
She also has a private clinic at the She is very passionate about women's health, empowering women with knowledge and understanding about their bodies and what may be happening to them.
You for this outstanding program initiative, Vincent and the Grenadines. So we will move right along into this presentation. Or folks, imagine there's no more cancer. Specifically, see somebody achievable. Open your eye and respond to me. Do you think this is achievable? Come on. The objectives today, we're just going to talk briefly about what exactly is cervical cancer, the cause of the vaccine. All right, so we're going to spend a little bit of time. I'm sure a lot of you would have questions about. Next slide. All right, so this is the top layer. The innermost layer is called the lining of the womb or the endometrium. We locally call this the neck of the womb or the birth canal. This is into the external environment. It will pass through the cervix. You know what you're preventing. We have to place an instrument through the vagina. We open it of the vagina so then we could see the cervix. This is the area along this lining right there where 2 different types penetrate surrounding normal tissue. Now, what is around the cervix? To move or rapidly grow, they can invade, can also spread via the lymphatic system, which is the system. So it keeps spreading and spreading. It goes from pelvis to abdomen, then or that's what we call advanced disease when it starts spreading out to surrounding. Dr. Nicholls gave us an idea of the stats in St. Vincent. Now, cervical cancer is a cancer that is all really, really low. Yet we see the Caribbean with all these high figures. We have to try to fly them out of St. Vincent to get chemo radiation, and this is such a painful death in a cancer that is. Let's talk about that. If a person develops one or more of the following symptoms, you need to see a health need. And we are telling you, people seeing the physician right? So what are you looking for? Now, I am not saying if you have a healthcare provider, it is just a I have heard patients say, if you don't have pain after experiencing menopause, so you had 1 whole year, you never seen. What do I mean by that? Your normal cycle is supposed to last 5 to 7 watery discharge with a strong odor or a bloody sex is not supposed to be painful. So if your bowel movements are painful or every you're bleeding, see a healthcare professional. Painful urination, even blown there all the time, or it feels like a dull ache, it's not intense. If a cancer potentially can be eliminated, that means we have enough information to track it to during sex. It's a sexually transmitted infection. This is the cell's DNA to continue replicating. So it finds its way and lead to cancer. So it's not because you have or you get HPV today and take about 10 to 15 years. So that is why it helps us if we could and do something about it before it of cancer. So if you look at this diagram, you could see once HPV gets into the cells, changes low-grade squamous intraepithelial lesions, which could raise cancer, is when it breaches the cell wall. So potentially, we can detect 30% of our female population between. So we have the risk factors. We are small population, right? More than I should say this. I was going to say more than likely, when you have sex with an individual, that would increase the risk of contracting HPV. If 30% have this high-risk strain of HPV, you could imagine how much HPV is currently on board and around right now. So I said that the cervical cancer elimination program that was launched. We started now screening for HPV to everyone privately at Sigma and CRL. However, it is the machinery that we need to actually isolate privately just to get the test process. Around $300, right? Now, the government recognizing that this HPV DNA testing is something that could potentially help people partnered with testing in 4 areas. Now, within the next 6 months, we are hoping to upscale to the length and breadth of St. Vincent and the Grenadines, where the I say this to say, from the little data we've done, with prevalence continuing to be 30% roughly. So even right now, these high-risk strains, they are prevalent. We need to be aware of the importance of screening. HPV DNA test is not easily accessible to you. Doctor spoke about doing your pap smears. What the pap smears do now, they look for, instead of trying to screen and look for the virus, the site look under a microscope for any abnormal changes that could potentially be if any abnormal cells are located. So there's no screening, whether it's HPV test or whether it's the pap smear. What I had to share was that if you are between the ages of, let's say most persons start having sex roughly, right? If you're between 18, Dr. Smile because she know plenty will have started having sex between 18 and 30, right? In that age group. Will detect HPV or will have HPV, right? That's how frequent and rampant this virus is. By the time you are ages 30 and above, your body would have naturally cleared the HPV. When we do get beyond age 30, that's why it doesn't make any sense for us to do HPV screening if you're 30 years and younger, because we know will be positive. So therefore, we wait to see if their immune system will naturally clear the virus. If not, and it's persisting, that's when. Right, let's move rapidly. Next slide. All right, so if you are immunosuppressed, whether it's by HIV, organ transplant, or just medication, and just a disclaimer, condom usage can prevent infection. So those are the main risk factors. So as physicians, we ask you a little bit about your history, your lifetime, not because we want to know your business, it's because we are trying to risk stratify you higher risk for having a sexually transmitted infection. And if that is the case, your 3 years, etc. So it depends on your risk factor. Some persons, they may come back to the doctor the next year, and I see some men here, and I'm very thankful for men who affects the woman will affect you indirectly with HPV as a woman. So we tend to call the men the carriers. They carry the virus, but they get to live a life that is wonderful and blessed, right? Because people are so rare. While HPV causes it, it's not as common as cervical cancer. HPV affects penile, oral, and the anal mucosa. We can't screen men fast. Please wear a condom, right? Studies have shown that the high frequency use of condoms can reduce the risk of infection. Move on. So currently, we spoke about the screening methods in St. Vincent and the Grenadines. We have offered further testing, vinegar, diluting screen, right? Most times they ask, when was the last pap smear? 2040 that are lately diagnosed, they didn't have a pap smear within the last 5 years. So it's something that we point of why screening is important. All right. Let's move on, Doc. All right, now, that was secondary prevention. So that is just as powerful. That could help with preventing vaccine works, right? The vaccine has been known cervical cancer in most first world countries. Australia eliminating cervical cancer because they've introduced HPV to study, because the vaccine was first introduced in 2004. It's not like the COVID virus that just came out the other day. It wasn't around for a long time. The HPV vaccine has been around over 20 years, and we can look at whether the persistence of HPV got more, and we could see from analysis of the data and various studies and trials that the vaccine is effective. So how does it work? It works by system to produce antibodies, diseases. It's very effective in preventing precancers and cancer. Now, looking at the side effect profile, and everybody is concerned about that. What are the side effects? The data shows that the serious side effects are almost non-existent. 0.01 as all the other vaccines and their side effect profile. That is really what the HPV like. Now, what is the recommendation? The recommendation. The or boys and girls start getting vaccinated, the better. Before they become sexually active. The disease child ages 9 to 14 will bear fruit by the time they reach in their 20s and now ready to be sexually active. 9 to 14. The immune system is armed. It's armed. It's defense that starts building up throughout the years. The earlier response will be, right? So if you wait until you are later, like in your teens, of the vaccine will not be great. Do you follow? So parents with children between the ages of 9 to 14, we are not saying vaccinate your. That is not the goal. That is not the reason. We are saying vaccinate your child between ages 10 to 14 so they could launch such a response. So by the time they are in their 20s now, the immunity will be high. That is the reason for encouraging the vaccine. Now, as I mentioned, the vaccine can still be given up to the ages of 45. Drops once you start having sex. So the target is to get in sex. Let's move on. And this is all trials that I put there from this side of my mouth. It's tested, it's tried. We can't go through every one of them now, but these are all of this being done. Future trial 1, future trial 2. These are the years when they were done. These are how many women are vaccinated looking for side effects. All right, let's move on, Doc. This is telling us a bit of data before the pre-vaccination era, what these stats were like, and then looking at the prevalence in the vaccinated, you can see how the numbers drastically. So we know, I can tell you the facts that the vaccines truly work. Let's move on, Doc. Oh, just go back one, Doc. Right. So looking at all the studies that I mentioned, right? And you can see how many patients were reviewed, right? 14,000 adolescents. In another instant, they look at persons that receive 23 million people. They even look at pregnant women who are vaccinated. And if you look at the adverse effects, you can see that it really is just as any other vaccine. The most common is a little redness on the site. Some people might have a temperature, but there's hardly any rare side effects. Let's move on, Doc. All right, so before I conclude, I just want to debunk some myths. Number one myth you're hearing, even in our own population in St. Vincent and the Grenadines, I'm hearing it. People are saying the vaccine is unsafe. Why it is considered safe. So this is a myth. I need you now to go out and help me to debunk. People are saying you can get HPV from the vaccination. Foolishness again. The vaccine does not infect you with HPV. it protects you against HPV. Vaccine increases risky sexual behavior. Whether we give 10 vaccine, whether we give 20 vaccine, whether we give no vaccine, who wants to have sex will still have sex. You agree or disagree with me? All right. Only females should receive the vaccination, another myth. The vaccine is tested and safe for both boys and girls. Pap smears make the vaccine unnecessary, not true. Even if you get vaccinated, you still need to be screened because while I said cervical cancer is called all cases of cervical cancer, you still have cases of cervical cancer that is unrelated to HPV, and so we still encourage individuals to screen. The vaccine does not lead to infertility. Get pregnant, you can still have children. If you're not getting pregnant, it's not the vaccine cause it, okay? It's a different issue, and you need to be worked up for whatever that issue is. Those who are vaccinated don't need screening. Again, we just spoke about that. You still need screening. Cervical cancer is the only cancer that the vaccine prevents. We learned about anal, penile, throat cancer. The vaccine can also prevent those types of cancers. So whenever you hear anybody talking about those things, and you know it's foolishness, stand up and defend, because it is important you get the message out. It is estimated that if vaccine rates reach 70% worldwide, if we reach that vaccine uptake rate, we would expect to see a decrease of 344,520 new cases of cervical cancer annually, and avoid 178,182 cervical cancer-related deaths, right? If only people would agree and understand the importance of the vaccine. So in conclusion, cervical cancer theoretically should no longer exist in St. Vincent and the Grenadines. Primary and secondary prevention is key to eliminating cervical cancer. HPV is the primary cause. If you don't remember nothing else I say, remember this slide. And screening should focus on HPV detection when possible, but alternatives such as the pap smears, they are available and more easily accessible. HPV vaccination is safe and efficacious. Women and men can still get the vaccine up to age 45. Ladies and gentlemen, thank you very much. You've been great.
Okay, thank you very much. We can do better than that. Put your hands together for Dr. Baptiste-Sylvester. All right, so we've and answers. I'm sure you guys have a lot of questions. Hopefully you have some questions there, and we will acknowledge you and give you a chance to speak. Okay, so I will get the ball rolling. I had a lot of questions, but I had a very, very thorough presentation, so I might have to throw my little questions aside. But the first question, a woman who is hesitant or fearful about getting screened.
I hand over to the wealth of experience.
As I said earlier, cervical cancer is preventable. And if it's preventable, we should, as women, find the ways to try and ensure that we don't develop cervical cancer. Unfortunately for us women, we can't see our cervix. The man could look at it, he could hold it up and down. For us, our cervix is inside. We cannot see it. If you get a cut on your hand, right, you would see it festering and you will go and get it sorted out. Not so with the cervix. We need to know that we have to screen in order to prevent cervical cancer. A lot of people go online and they read up and they say, do your pap smears every 3 years. You have to know what's happening in your community, your country. Doctor just told us 30% of women will get cervical cancer. I am sure we have 20 women inside here, which means that 6 of us, if we not take care of ourselves, will get cervical cancer. Because if we have 30%, that is 3 in 10, yes? So 6 of us will get cervical cancer if we don't do our screening. It doesn't take a long process, even if we're doing the pap smear or the HPV. Less than a minute to do a pap smear. And a lot of women say after finish, oh, how come everybody tell me it was so a little bit intrusive, it's a little bit cold, but a pap smear or your HPV testing is all we need to do, and we just have to do it.
And just to add to what Doctor is saying, I always tell patients 15 seconds of discomfort can prevent a lifetime of pain. So don't gamble with your nobody telling you it feel like a scratch back or a hug up, right? We're not going to lie to you. Little uncomfortable, right? It should not be over. Just purpose in your mind. Just 15 to 20 seconds of discomfort will save you a lifetime of pain.
Okay.
And not just a lifetime of financially too. Yeah, because if you have to go to Trinidad, it's 60,000 US dollars. That's house and land for persons.
Okay, do we have any questions from the audience? Okay, we have.
Good afternoon, everyone. I'm under the age of 30. I do my pap smears. Do I still get tested for HPV, or do I have to wait until I'm 30?
Yes, so you have to wait until you're 30. The recommendation will just, the recommendation for 30, if you do it before, it's either because you're HIV positive, overly high risk, and that can tend to lead to over-treatment because it's so prevalent. We prefer to wait until your body will naturally clear it. Okay?
And my next question is there treatment for HPV?
Yes, so there's a whole protocol that we have launched. Not necessarily with treating HPV, we are treating the cervix because HPV can do things such as ablation, cryotherapy, if someone has high risk. Destroy, thanks Doc, is to destroy that area where cervical cancer tends to come from. Seen cases where after burning and treatment, when we screen after, the HPV no longer exists because it probably was just located in that area. But the idea is we can treat the cervix before cancer arises.
Okay, now you said that, I have another question. Not contracts, but developed cervical cancer. Majority of them that died, was it already chemotherapy here for that, or is just for different cancers?
So we offer chemotherapy in St. Vincent, but the recommendation for advanced cervical cancer, once you meet the criteria, so your liver have to be working good, your kidney has to be working good, is what of chemo and radiation. So both of them work simultaneously. It drops rapidly.
We have radiation in St. Vincent.
Oh, okay. So that's why majority of persons have
yes,
to
for chemo radiation.
Okay.
And you have to remember sometimes that we don't have the chemotherapy drugs. Yes?
Questions from the audience?
Yes, thank you very much. This session was indeed informative and could be. So against the backdrop of that last question that was asked, and the fact that buying patients out can be quite exorbitant, I would like to know recommendations for our ladies in St. Vincent and the Grenadines to become a member of the Massa Life Station is a wise decision where they can save a lot of finances and to Dr. Nicholls, I'm happy as a Massa member, I'm happy to know that you'll be answering this.
A case I had, a patient was sent to me by Dr. Charles. She was having bleeding. And I looked at her cervix. And it came back showing she had cancer, early cancer. So when I was telling her, she broke down. She started to cry. And I'm there trying to, you know, comfort her. She said, "Doc, you know why you're crying?" She didn't cancel it. And that insurance was able to allow her to go to Trinidad. And she got brachytherapy and other treatment. And she actually had a child. Yes? So I mean, I know insurance companies give us so much trouble. When it comes to, when it comes to getting your money, it's, I see Rachel there, you know. Pan American, all of them give us trouble.
No,
Yes,
but
yes,
yeah.
the Massa.
Yeah.
So I would agree with you, Miss. we should consider getting Massa also.
Yeah, because
Okay.
an air spoke about out of pocket, it's about 65,000 EC dollars, and when you're a Massa member, you pay absolutely $0 for that same flight. Thank you.
Good afternoon. I have two questions. Doc mentioned 4 different places you could go and get your HPV test screening. I would like to know what are those 4 places, please.
4 areas are for individuals who live in that district, okay? So ID card in from douching, medication, or sex for 48 hours. The 4 areas are leave. Second is the Caliacua district, so you have to be living in that zone. Areas in Caliacua would be the Belair Health Center, Stubbs Polyclinic, Caliacua Health Center. That's 2 districts. The 3rd district is Georgetown. You can go to the but you have to be living in that area. And the 4th one is Pembroke. And there's one more offering it. Is it Barley? I believe. So there are 2 areas in that health center, in that district. Now, if you still go to your nearest health center, pap smears are now free throughout the length and breadth of St. Vincent and the Grenadines at the health centers. The only thing is, it would be the medium we're using is the conventional type. That is the spatula and the slide. I am saying this to say, if you have $0 in your pocket, no excuse why you can't.
That I have a 3rd question. I am actually from Union Island, and you now mentioned pap smear is free, but I've done pap smear in Union Island and had to pay for it to come up here in order to get.
Remember, Doc just said one is effective 1 month ago.
Okay, I didn't. Okay.
Just wanted to show you on the screen what we're offering is the conventional method, which is a spatula. That's what the government would offer the brush. It's the most sensitive cells. And slide, and depending on the thickness, you may not see as much. So there's a disadvantage. So it makes it easier for the cytologist to get the cells. Okay. So conventional method. All right, and what Dr. Baptiste told you about, and eventually to be offered to everybody. So if you said you're from Union Island, where are you living now?
Old Montrose.
Old Montrose. So Kingston is not offered yet, because you would actually fall on the King. Within 6 months, we should be able to offer it to you.
Okay, final question. I've gotten my HPV vaccine in Trinidad. And also, if you should go and get tested again.
All right. So every year, or I shouldn't say every year, ever so often, when vaccines were now offered, when they originally came out against HPV, they were offering vaccines 16 and 18. Those were the two strains that were known to cause the majority of increase, and most studies were done. We found other high-risk strains that were associated protects mainly against 4 different strains were created. This vaccine covered 16, 18, 6, and 11. 6 and 11, they can tend to cause warts, right? That is what we have currently available in St. Vincent and the Grenadines. And now I'm not sure what vaccine you got in Trinidad. There's a better vaccine that was created that covers 9 high-risk strains of HPV. That's because I'm pleased to tell you, we're in the process of trying to get that vaccine to offer our boys and girls and in St. Vincent and the Grenadines. No, note I said, even if you got vaccinated, we still encourage screening. Okay. If you're screening via HPV tests, if you do the HPV and you're negative, you don't have to do any more screening for another 5 years. Okay. So even though it's expensive, it costs $300, I still say you work out the maths. If you are spending $70 every year to do a pap smear, by the time you add that up, it'll be way over the $300. So for individuals who have a little extra money and don't know what to do with it, get your HPV DNA testing done. All right?
All right, thank you.
So just to confirm, the Gardasil 9, which is a more sophisticated vaccine, will be offered next year for sure. The government is actually working on that. That's what Sister said. All right? But what we have right now is Gardasil 4. So it's still better than nothing at all. Okay?
Okay, we had another question.
Good evening, everyone. Doctors, good evening. I'm just asking because I know when there was talk about the HPV vaccine, I know some people approached me to know if they should allow their children, their daughters, to have this vaccine because of some of the things you mentioned, because some felt that, it's going to allow the children to go out early in some sexual behavior, and also to know the pros and cons, what's going to happen afterwards, the children are going to get infected. Some of them are still developing. I think you mentioned from about 8, 9, 10. They're still developing. I'm sure if you have anything else to add to that, because people are wondering to what's going to happen. It is true, it said that it benefits preventing having these diseases as it had in Australia, but people are wondering what's going to happen to the children, boys or girls.
Okay, I think I was very clear to, talk about the myths. Those are what we call facts. There's no evidence. There's nothing to support those concerns. I think it's just over time, people just had their fears and they start making up things to say why you shouldn't do something. Just like the pap smear, people will tell you 10 reasons why you shouldn't have a pap smear done. They will never mention it could save your life. I'm talking about ignorant people here, not y'all, right? Because y'all not going to say that. But I'm saying at the end of the day, if individuals have those lovingly try to let them know there's no evidence that supports this sort of thinking, right? Because if you vaccinate your child, the child will want to have sex. A child will want to have sex whether or not the vaccine is involved. If the child is bent wanting, nothing to do with the vaccine.
Flavia, I just wanted to go back a little bit. All of us had our measles vaccine, and we never questioned, or our parents never questioned, whether we should have the MMR. All right? Right now in America, there was an article that came out this week saying that the Americas are now, they've lost the whole thing about measles. We had all these anti-vaxxers coming out, and now measles is rampant in the States. Like everything else, it's new, and some people advocate in St. Vincent down. I'm going to go back a little bit. In 2015, when we did the pilot study, they brought out the HPV vaccine program, and it was doing very well. Yes, they went into the schools until they got to certain areas, and the talk came about, stop the vaccination, and that just messed up the whole, that caused so much confusion. Yes, so is what's going to help us to allow our to get vaccinated, because we need to eliminate cervical cancer. And every time I go on the ward, and you tend to know, before, as you enter the ward, you know we have a cervical cancer, dignifying death. Wow. And if we can stop and educate our and ensure that our little ones, both boys and girls, are vaccinated, we're going into it. We're not going to see it now.
Okay.
Okay? So as a teacher, you need to say it's important that we vaccinate all. And we need to, that's the message we need to carry out. We need to vaccinate. We need to get this program off the ground. We need to do it.
Well, thank you very kindly, because I was not sure. They were connected to me what would happen, because they felt the children weren't developing the sort of for the girls and all that too, and also, after effects, and not only the part when you mentioned about being promiscuous or so on. The organs, what would happen to the persons after, and in between, if you had enough testing done, the vaccines, So
we give our babies measles vaccine at what? What age we give them? 10
months.
1 month, 2 months? I can't remember.
3 months or so.
2 months. Our babies grow. You understand what I'm saying? We just have to, and what Doctor was showing you is all the studies that have been done on the elimination of cervical cancer in Australia. No cancers. That's what we need.
Oh, okay.
And these are first world countries that can afford for people to, if they get cancer, they have a program that will help them. Chemo, radiation. In St. Vincent, we don't have anything.
I think that's what they felt to, because these more developed countries have what it takes to have treatment if anything happens.
Well, we need to get on board and get vaccinated so we don't have to.
We need to prevent. We can't wait till we get the actual cancer. So our heavy push has to be prevention. And two arms we spoke about when it comes to prevention, vaccination and screening. The two arms must work together. Okay?
Okay, thank you.
Okay, so another question. How the treatment options vary depending on the stage of cervical cancer? And let's say, for example, a woman is past menopause. Is hysterectomy a good option as a treatment option? Yeah.
All right, so the treatment options vary for the age and whether the person has fertility desires. If the cancer is very early, like stage 1A, right, we can tend to do a cone biopsy or simple hysterectomy. If it's greater than that, we tend to do a radical hysterectomy. If it's greater than a stage 2B, right, which is where it's now spread to the areas that are just outside of the cervix, we call it the parametrium. They are filmy tissue just lining the uterus and the cervix. If it's spread to that area only, they are no longer surgical treatment, but then must have chemoradiation.
Okay, are there any more questions from the audience? Do we have any questions on social media? No? Okay, before we wrap up, I just want to allow the doctors to maybe say something in closing. If there's anything you want to emphasize, re-emphasize.
All right. If you don't remember anything, cervical cancer is preventable. And if we can prevent it, we need to empower ourselves with information, with screening done, whether it's by pap smears or HPV testing. If it shows that there are early changes that may lead to cancer, we have lots of different treatment modalities that we could offer you and to process so that you don't get cervical cancer. Vigilant with our follow-up, but we are preventing you from getting cervical cancer. And modalities here in St. Vincent to prevent cancer, but if
one of you with the responsibility to reach your mother, your sister, your friend, your auntie, your uncle, your boyfriend, whoever is in your life. And I can't do it alone, and our two physician colleagues are here, which we acknowledge as well. We can single one of you to join the fight in preventing cervical cancer in St. Vincent and the Grenadines.
Can you just... Oh, one more question?
So you would have to see a healthcare provider first. Yes, so a healthcare provider has to do it, whether it's a nurse, whether it's Planned Parenthood, whether it's a private doctor. Are comfortable, they will have to take this sample for you and CRL.
Okay, so we want to again put our hands together for Dr. Nicholls, Dr. Baptiste-Sylvester. To welcome back our marketing manager to wrap things up.
Brief thank you. A special thank you to Dr. Baptiste-Sylvester and Dr. Nicholls. And ensuring that we are aware of the options and for giving us the charge of being a part of the nation of cervical cancer here in St. Vincent and the Grenadines. We Kevin Weeks for streaming, our photographer, Simo Hines, NLS Sounds for audio, and to you, our audience, both Co-Operative Credit Union headquarters and those viewing online. We truly appreciate you taking the time out this afternoon to be a part of our 5th annual health symposium. I hope that your journey home is safe, and we look forward to seeing you next year. Maybe not the same time, but we'll be here, same place, and we'll be here discussing another topic. So thank you very much. And before we leave, I also want to acknowledge Mr. Stapleton and his colleague. Have a chat with him about if you're interested in signing up for MASA, and he also has his Lviv products on display as well. So do have a chat with him and see how he can get you signed up for MASA. We also would like to say a special thanks. We have some tokens of appreciation for both Dr. Baptiste-Sylvester and Dr. Nicholls. We'll Baptiste-Sylvester. All right, so once again, thank you for being here. We truly appreciate and do enjoy.